Thank you. Thank you, Divamala ji, and thank you, Hindi team. Before beginning the session, I have to say to Dr. OnePlus, no, I don't know the name of you, doctor. Please put your name instead of the mobile name. Okay, so it will be easy for us to identify even for calling also. Okay. Thank you, doctor. The doctor who hand raised, no?
Yeah, I understand, sister. You can continue. You can continue,
Okay.
Anjali.
Okay, thank you, sir. Thank you. Thank you, everyone. Now we are moving to today's English session. Welcome, everyone, for today's English session. Today is our 1444th day of continuous webinar. For the last 1443 days, we are continuously conducting this webinar without any break, without any leave. So, many doctors, many homeopathic lovers are struggling behind to conduct this program. I'm giving thanks to all the participants even because your participation is the inspiration for us. Okay, before beginning the session, as usual, we will have a silent prayer. Good evening once again. Welcome every participants to today's session. Today's our guest is Dr. MRIDUL Murali Krishna. He's MBBS doctor and he's a family medicine physician, and he got CCEPC and consultant family physician in St. Joseph's Hospital, Patanapuram, and SRK Serene Clinic in Thiruvananthapuram and Puttur. And more than 11 years of experience he have. And one more thing I wanted to add, he is the son-in-law of both homeopathic Dr. Geeta Nandakumar and Dr. Nandakumar. So normally our aim and intention is to integrate all systems together. This is the integration of two systems. This is the rare union of two systems. So I am welcoming Dr. MRIDUL Murali Krishna to our forum. Normally we have most of our international participants are allopaths, but they love homeopathy. Likewise, Dr. MRIDUL Murali Krishna also loving homeopathy, I think so. I am welcoming him to our session. Doctor, please. He has joined, right? Okay. Oh, I'll make you as a co-host.
Yeah.
Oh, sorry.
That's good.
Okay, you are welcome.
Thank you for the warm welcome. So, good evening to one and all.
Son-in-law of a homeopathic family.
Yeah.
So, when you started loving homeopathy, before marriage or after marriage?
I think I have taken homeo medicines when I was a kid.
Before that, okay.
Yeah, but the thing is, I was advised not to take coffee with homeo medicine, but I was a coffee addict. So I was never able to keep up with that.
Okay, but only for few medicines, not every medicine, not suddenly after or suddenly before taking medicine. Okay, you can start your session. Everyone is waiting for that.
Okay, so when I was asked to pick a topic, I've taken quite a few topics, including thyroid and all those things. So I didn't want to repeat the topic again. So I chose hepatic encephalopathy because I don't know what's the condition outside states. Right now, 2 days back, I had a patient with hepatic encephalopathy, and he was missed in the initial hospital. And they thought he was having some hyponatremia. And he had the symptoms for like 3 or 4 days prior to his visit to the ER. So he came to the ER, and luckily my junior doctor, he was quite skilled to identify the case, and he immediately called me because I just taught him 2 days back about the same thing. So when it comes to MBBS, as well as when I did my DNB post graduation, then also hepatic encephalopathy was a very common case for discussion for the exams, and it's a very common case in the ICU as well as the wards. And most often it's quite missed now. I don't know why, because when I did my house agency, it was a very common thing. If there are like 15 patients admitted in 4 hours, if 15 patients come, like at least 4 of them might be having hepatic encephalopathy. And it's a case that occurs in the surgical ward as well as the medicine ward, because when a patient gets admitted for in a surgical ward, it can be an acute abdomen. It can be patient is having a variceal bleed. All those things can precipitate. So it's a very common thing. So I'll just share my screen.
Yes, sure. You can share. It's visible.
Okay. So today's topic, I'll just go through the introduction, definition, the pathophysiology, and the recent advances. And I won't be going into detail about the treatment part because it varies in different systems. So coming to the definition, it's a complex neuropsychiatric syndrome that arises as a result of liver dysfunction. And it typically manifests in patients with advanced liver disease, and particularly in those with cirrhosis. Now, what is the importance of understanding hepatic encephalopathy? It's because the timely diagnosis and management is necessary, and this can significantly improve the patient's outcome and quality of life. It can range from subtle cognitive changes to profound coma, and every healthcare professional needs to know the whole spectrum of the disease. So when someone hears about hepatic encephalopathy, the only thing that the initial image that comes to your mind is always a patient who is completely disoriented, who might be saying all sorts of nonsense. The object of the presentation is to provide a comprehensive overview of HE and its pathophysiology, clinical features, diagnosis, and management. It will also discuss current research and future directions. So coming to the definition, it's a complex and potentially reversible neuropsychiatric syndrome. And that's the main thing. It's reversible. And it occurs in patients with liver dysfunction, particularly in the context of advanced liver disease, such as cirrhosis. It's characterized by a wide spectrum of neurological and psychological disturbances and ranges from subtle cognitive impairment to deep coma. Now, what does that indicate? Now, cirrhosis, as you all know, as you all will probably be treating, because when it comes to NASH, non-alcoholic steatohepatitis, I think right now a huge spectrum of patients are coming to you, because our treatment sometimes might not suit them. And so the key aspects is first liver dysfunction. It's related to liver dysfunction, especially in cases where the liver is unable to adequately filter the toxins from the blood. So this dysfunction occurs in both acute and chronic liver diseases, but it is most commonly associated with cirrhosis. Now, the next part is about the toxin accumulation. What is the primary role of liver? Liver is a detoxifier. So when the liver is compromised, the toxic substances, and the primary one that we need to note and that what we can measure is ammonia. It is a byproduct of protein metabolism. Again, that comes in the pathophysiology. And the accumulation of ammonia occurs in the bloodstream. Now, these toxins can cross the blood-brain barrier and affect brain function, and this leads to hepatic encephalopathy. Next is neuropsychiatric syndrome. The HE affects both neurological and the psychiatric systems. That's why I said patients feel that if for instance a policeman sees a patient who is having hepatic encephalopathy, because as we already said, it occurs in liver disease. So a chronic alcoholic who is by the roadside, and he might not be actually inebriated, but because of this HE, he might be behaving as an inebriated person because of his complete disorientation. So there comes the neurological and psychiatric systems. Neurologically, it can cause symptoms such as confusion, tremor, asterixis, that's a flapping tremor. And in severe cases, the patient can go into coma. Psychiatrically, it can lead to mood changes, altered mental status, and cognitive dysfunction. Now, next is the spectrum of the clinical presentation. It can vary widely and can be, it is characterized in the grades based on the severity. It can range from minimal to, as we have already said, a complete coma. So we have different testing also, which we will discuss. Now, these grades are often classified using something called the West Haven criteria. Grade 0, that is minimal, there are no symptoms, and it can be detected by specific tests only. Grade 1 is minimal cognitive impairment. There's a slight confusion. The patient has altered attention or personality changes. Like sometimes it's a similar case as seen in hyponatremia, because the patient initially the patient will say, I'm having some sort of weakness, and then suddenly the patient might behave like, what did I eat? Like he'll be going a bit confused. So yeah, even if if a husband sees a wife, oh, did I eat? Oh, when did I eat? Did I sleep? Or did I wake up now? Like he'll be confused and speaking randomly like that. Next is altered attention and personality changes. Then is grade 2, it's obvious disorientation, lethargy, and more pronounced behavioral changes. Next is severe confusion. There is marked disorientation and somnolence, but still the patient is arousable. That is, the patient is sleepy, but if you call them, they'll wake up. Next is coma. There is no response to verbal or painful stimuli. And initial presentation is there will be an alteration in the sleep habits of the patient. Like he'll be more sleepy in the morning and maybe a bit awake at night. The next part of the definition is as I said, the key part is it's reversible. One of the defining characteristics is that it's potentially reversible. And with appropriate treatment, with the reduction of ammonia levels and managing the precipitating factors, patients can recover. Something that I always tell every patient and in all the interviews that I attend is the best doctor, that's the body. Body is the best doctor. You just need to support the body, make sure that it is capable of healing itself. Because for everyone who shaves, they know if we get a cut, we don't need to take antibiotics and all those medicines for that cut to heal. We just need to leave it alone. But if we keep scratching that, it'll become a sore. So we have to correct the precipitating cause. So, and next is the triggers and precipitating factors. It is often precipitated by specific factors in patients with liver disease, such as GI bleed. That's what I said earlier. That's patients in the surgical ward can present with HE, infections, then dehydration, electrolyte imbalances, and certain medications can precipitate HE. Like, for instance, an alcoholic CLD patient, a chronic liver disease patient of alcoholic etiology, presenting with an distended abdomen, ascites. In allopathy, modern medicine, we give diuretics. So these diuretics have a high chance of precipitating HE, as well as we can sometimes they'll complain of decreased sleep, and prescribing over-the-counter sedatives can also precipitate HE. So we have to identify the triggers and treat accordingly. So in summary, definition of HE, it's a neuropsychiatric condition resulting from liver dysfunction leading to accumulation of toxins that impair the brain function, and it manifests across a broad spectrum of cognitive and neurological disturbances, and is a reversible condition if promptly and properly managed. So, what is a pathophysiology? So, it's a complex and multifactorial pathophysiology, and it involves a combination of liver dysfunction, systemic inflammation, alteration in brain function. But like most of the diseases, the exact mechanisms are still under research. But several key factors have been identified, and these have been identified for quite some time now. The first, as I already mentioned, is ammonia and nitrogenous toxins. So, what is the primary role of ammonia? Ammonia is considered the principal neurotoxin in HE. It is produced in the intestines from the breakdown of proteins and other nitrogenous compounds, and this is done by the gut bacteria. Normally, the liver converts ammonia into urea, which is excreted by the kidneys. However, when there is a liver dysfunction, this conversion of the toxin is impaired. So, ammonia level accumulates, and this causes problems inside the brain. So, how does ammonia affect the brain? Now, the elevated ammonia in the blood, it crosses the blood-brain barrier, and when it enters the brain, it acts on the astrocytes, the glial cells of the brain, and their functions are disturbed. So amyloid is metabolized by the astrocytes to glutamine, and this causes osmotic imbalance. So the astrocyte swells, and there is cerebral edema, and it causes neurological symptoms. We can correlate this with that of patients having hyponatremia also. It's somewhat similar to that. Next, there is a blood-brain barrier dysfunction. So in HE, there is the integrity of the blood-brain barrier, it is compromised. So more and more toxins is allowed to enter the brain. Next is alteration in the neurotransmission. So we all know the GABAergic system. It's a part of the physiology, positive physiology. One of the primary neurotransmitter system affected by the in HE is the GABAergic system. Now there is increased GABAergic tone, so it's an inhibitory neurotransmitter. This causes an increased dysfunction in HE. So the patient has lethargy, altered consciousness. Next, how it affects the dopaminergic system. As you know, it's the happy system. So the balance between the excitatory and inhibitory neurotransmitter is disturbed in HE. And dopamine is excitatory neurotransmitter, and it gets decreased. So the patient goes into drowsy, somnolent state. Next is oxidative stress and mitochondrial dysfunction. Now, this oxidative stress and mitochondrial dysfunction is one of the most common form of pathology in most of the chronic diseases and most of the including diabetes. Now, ammonia and other toxins contribute to oxidative stress within the brain. It damages cellular component and impairs neural function, mitochondrial dysfunction. Now, this occurs not just because of HE, in all kinds of liver diseases, in diabetes, in heart disease, chronic heart diseases, in chronic kidney diseases. In all those states, there is an oxidative stress and there is mitochondrial dysfunction, and the patient can have even more worsened symptoms. Next is systemic inflammation. Now, as we already said, in what kind of patient does HE occur? It occurs in patients having liver disease, and there is already systemic inflammation because of release of pro-inflammatory mediators. Now, and it exacerbates all the symptoms, and it increases whatever we have mentioned already. The ammonia level, the blood-brain barrier dysfunction, the oxidative stress, everything. Next is the gut-liver-brain axis. Now, I think it's one of the most commonly discussed fact, even internationally. The gut-liver-brain axis about probiotics, the misuse of antibiotics. The gut microbiota is one of the most important thing. And in the recent times, people have come to understand the importance of the probiotic flora, because one thing that I've always said is, if we have a very good mason, he is one of the best in the world. Think of the best mason in the world. If he doesn't have enough bricks and enough cement, he can't build a house. However skilled he is, without the raw materials, he can't work. Our body gets most of the some of the most important vitamins and essential things from our gut microbiota. I don't know if you heard this. For COPD, chronic obstructive pulmonary disease, recently pulmonologists have been prescribing a bacteria, Bifidobacterium lactis. The bacteria actually helps in improving COPD symptoms. It's not a bronchodilator. It's not a steroid. Nothing. It's just a bacteria. This probiotic has been proven to show a better outcome in COPD. Again, a similar bacteria are being used in CKD patients, and it has shown to decrease the creatinine levels. So this gut microbiome gets altered. This is known as dysbiosis. This dysbiosis increases these neurotoxins. That is, we lose the good guys and we have an increase in the bad guys. Then the last one, as we mentioned initially, the increased cerebral edema. Because of all these things, there is an increase in the there's cerebral edema, which causes a swelling in the brain. There is increased intracranial potential, and this is potentially life-threatening. And why is that? If we remember the initial anatomy, when there is an increased cerebral edema, the brain tends to herniate. And the skull, it's like a metal box. So the only way the brain can escape is through something in Kerala. In most of the movies, don't get stuck in your oblongata, they always say. So the thing is, the respiratory center is there. So when there is a severe cerebral edema, the brain herniates, the respiratory center is gone, the patient gets into a respiratory arrest and goes. Next is genetic and environmental factors. People can have genetic predisposition, and everyone's body's limit to handle such things varies. So alcohol use, infections, medications, all those things have a very significant role in the development and progression of HE. So again, a summary of our pathophysiology. It results from a complex interplay between liver dysfunction, ammonia accumulation, systemic inflammation, and neurotoxic effects. And understanding its root pathology and physiology helps us in managing the condition. Next is the clinical presentation and diagnosis. So why is this crucial? Because we need a timely identification. With timely identification, there needs to be appropriate management. So HE can present with a wide range of neurological and psychological symptoms, and its diagnosis often requires careful clinical assessment and use of specific diagnostic tools. So the clinical presentation, it's a spectrum of symptoms, cognitive changes. They can exhibit confusion, forgetfulness, decreased attention span, difficulty in concentration, and in milder forms, there may be subtle and only detectable through detailed testing. Like we mentioned earlier in the West Haven criteria, grade 0 and grade 1. Now, in behavioral changes, they can cause personality changes, irritability, apathy, mood swings, and they show disinhibition, inappropriate behavior. They can just rip off their clothes, and a person who is usually a very mild, gentle-mannered person can suddenly become a very agitated, violent person. Now, how is that? And the primary reason being a patient can it's like what's seen in dementia. Next is motor symptoms. Motor abnormalities such as asterixis, it's the characteristic flapping tremor of the hands. So we ask the patient to hold the hand like this, and some people actually hold it over the bed, they restrain it over the bed, and then the hand will go flapping it. It's because of the action of the tendons. It can't hold them down. Next is dysarthria, that's slurred speech. And then is ataxia, patient cannot coordinate his movements. These are very common. Then what does it indicate? It indicates underlying neurological impairment. Next is, as I've already mentioned earlier, there's altered sleep pattern, which includes increased daytime sleepiness and nighttime insomnia. These are the early signs. Next there can be consciousness alterations, like patient can progress to stupor, coma, and it's a life-threatening condition. Now, we have already mentioned the West Haven criteria. Now, precipitating factors, it's often precipitated by factors such as GI bleed, infections, constipation, dehydration, sedatives, and alcohol. Next is a diagnostic approach. First is clinical assessment. For every disease, something that I always say, let it be a blood test, let it be an X-ray, let it be an ultrasound, let it be a CT, let it be an MRI. All those things are shadows. All those things are shadows of what is actually there. So you can purely rely on them. And you've seen in all the ultrasound reports, all the CT scans, kindly correlate clinically. That's something for medical purposes also. So we have to relate it with clinical skill and experience. A thorough history and physical examination is the first thing to be done. Key components include assessing the mental status. We use a mini mental state examination. I look for signs of liver disease because we need to identify a cause. The cause has to be identified and evaluate for acidosis and other neurological signs. For the lab test, I've already mentioned the primary toxin, that is ammonia. It has to be measured and the level can be correlated clinically. Then consider other causes. Do LFTs, do RFTs, electrolyte abnormality like dyslipidemia, we have already mentioned. Next is neuropsychological testing. So in cases of minimal HE, that is grade 0, where symptoms are subtle, psychometric tests such as the psychometric hepatic encephalopathy score, PHES, or continuous reaction time, CRT, it can detect cognitive impairments. Then there is a number connection test. It's a simple and widely used test where patients are asked to connect the numbered circles in sequence. And it has to be done quickly as possible. So like you can draw the numbers and circle them, and the patient has to connect it. Next is imaging. So brain imaging, we can do MRI, CT, and these things are not typically required because just imagine the patient going into severe cerebral edema. The patient can immediately herniate. So detecting that in a CT and MRI might be something that will be late. Next is liver imaging. Why? Because we need to identify the root cause. Next is EEG. Now, what is the primary role of EEG? Is it detects the changes in brainwave pattern. In HE, there is something called triphasic waves, which is suggestive but not specific. So in summary, about the diagnostic approach, the clinical presentation of HE can range from mild cognitive changes to a deep coma. Diagnosis based on clinical assessment supported by lab tests and neuropsychological testing and occasionally imaging. Recognizing the signs and symptoms early is crucial for effective management. Now, advances in understanding pathophysiology. So I've skipped over the management part because when it comes to us, we primarily treat the root cause, whatever it is. It can be a GI bleed. We control it surgically, and then we give antibiotics. We try to control the infection. We try to control the bleeding, and we try to clear the gut with. We do give an antibiotic, but that's not for the infection. It's to clear the gut, whole bacteria from the gut. So there will be a decreased level of ammonia, and then we do a protein restriction. Now, coming to the advances, the microbiome gut-liver-brain axis. Now, the recent studies emphasize the role of gut microbiome, like I've already said. Dysbiosis or imbalance in gut bacteria, it contributes immensely to the increased ammonia level and other neurotoxins. So we need to understand the gut more. So we use probiotics, prebiotics. Recently, very prominent medical company has introduced a new probiotic, which is very healthy gut bacteria, and it is resistance to the strain of the resistance to the antibiotic that we give for HE. So this bacteria actually decreases the ammonia level also. Next is inflammation and neuroinflammation. There is systemic inflammation is recognized as a key factor of HE. So researchers focused on how these anti-inflammatory treatments might mitigate the HE symptoms. For example, targeting TNF alpha, interleukin 6. These are elevated in HE. And by decreasing these levels, sometimes we might be able to reduce the neuroinflammation and improve the neurological outcome. Next is the blood-brain barrier dysfunction that we mentioned earlier. Advances in neuroimaging are allowing us to study the integrity of the blood-brain barrier. So understanding why and how it becomes permeable, we might be able to stop the toxins from going inside the brain. Now, imaging therapies are albumin dialysis or mass therapy or molecular absorbent recirculating system. It's a liver support therapy that can remove toxins from the blood, including ammonia, bile acids, cytokines, and it it can be beneficial in acute or chronic liver failure and HE. Next is something that's most of the people know now. It's a fecal microbiota transplant. Like I mentioned, an over-the-counter use of antibiotics, which has been there for some time now. But right now, it's actually decreased really well, because more than 1,000 crores has decreased the amount spent on that, because over-the-counter antibiotics are not being given right now. So using over-the-counter antibiotics, it actually even happens from the newborn stage. Sometimes a newborn is being given antibiotics, just like a preventive antibiotic. Even in some of the good knee replacement centers right now, they give only a single dose of antibiotic. For a replacement of even both the knees, a single antibiotic is given. So there is no need for a week, twice daily antibiotic or anything for an aseptic procedure. If it's done right, there is no need for an antibiotic. So why is it given? It's just a precautionary, a single dose. Other than that, even only mild analgesics are being given right now. So fecal microbiota transplantation is transferring a stool of a healthy donor into the GI tract of a patient to restore a healthy microbiome. Now, preliminary studies suggest that it can reduce HE episodes by rebalancing gut bacteria. And whose stool will we take? It's usually taken from a donor in the same family. Next is newer drugs. I don't know if we can call it a drug. It's L-ornithine L-aspartate, Lula. It's an amino acid compound. It promotes ammonia detoxification through the urea cycle and glutamine synthesis. It has been studied as an adjunct therapy, and it is being used for quite some time now. Next is GABA receptor modulators. Now, GABA neurotransmission is altered in HE. So, drugs are being considered to restore that balance. And sometimes we might be able to potentially reduce HE symptoms. Last is gene therapy and personalized medicine. So, with the advent of AI, how we can approach a disease is being rapidly changed. I've mentioned it to most of my friends and my father-in-law, my mother-in-law, my wife. AI is the next big thing. And some people think it won't be a huge factor, but the people who use it, and I do use it quite often, do understand that what it's capable of. It's like a 3-year-old child right now. In 3 years, it will be far beyond what it's right now. It can draw, it can create videos, it can understand, it can, if you take a photo and give it to the AI right now, it can say if you're bored, if you're angry, if there's a screenshot of the whole screen right now, I think some might be even thinking, oh, what is he talking about? So it can understand all those emotions. A human might not be able to do that. So with the advent of AI, the way we are understanding all these diseases, it's changing rapidly. Integrating all those things, even in the very near future, all the systems of medicines might be understood clearly by a single entity. So a single person who is a very good MBBS, Ayurveda, Homeo, Siddha, knowledge of all those things, including ancient texts. That is what AI is being capable of. Next is non-invasive diagnostic tools, biomarkers. The search of reliable biomarkers to diagnose and monitor HE is ongoing, and potential biomarkers are under investigation. And the only thing we have right now is ammonia, and then test to understand the cause. So we can also find ammonia-related metabolites, inflammatory cytokines, and markers for astrocyte damage, because as we have already mentioned, astrocyte damage is what causes all the neurological and motor psychiatric problems. Next is advanced imaging techniques, PET, magnetic resonance spectroscopy. But all these things has to be, what is the word? It has to be economically feasible. Next is portable monitoring device. So, like we mentioned earlier, early on, detecting ketone bodies in the urine or blood, it was quite hard. But right now we have small machines that can detect blood ketone levels. Like it's similar to using a glucometer. You just prick your finger, give a drop of blood, and it will tell you the ketone levels. And now, why is it important? Because in diabetes there is diabetic ketoacidosis. Like that, there will be similar machines that can detect either ammonia or ammonia-related metabolites, things like that, and it will be very easy to detect if the patient is having having a mild or is going in for an HE. Prevention and long-term management strategies. So chronic HE management protocols, research is focusing on developing standardized protocols for long-term management of chronic HE. This includes optimizing use of lactose, rifaximin. These are drugs that we use, like I mentioned earlier, the antibiotics and novel agents, and improving patient adherence to treatment regimens. Now, there has to be education and self-management program for the patients and the caregivers, because as I've already mentioned, the patient might not be able to take the medicine or and do all the necessary things on their own, because they will be disoriented. And next is modern medicine, liver transplantation. Liver transplantation remains a definitive treatment for patients with advanced liver disease and recurrent HE. So I won't go into detail about it. So with that, my presentation comes to a conclusion, because I won't be going into the details of the treatment part from the allopathy point of view. I've gone into a bit into that about the antibiotics and the lactose and all those things. So thank you for the patient listening.
Thank you, doctor. Thank you so much. I think the participants have, if you have any questions, means you can hand raise and ask to Dr. MRIDUL. I think we have enough time. Now it is 7:38 here.
Oh, I just noticed it now. Please speak slowly. Oh,
Okay.
sorry, it was a bit fast. I need to repeat something, please.
Message. Okay. Doctors, please respond. If you have any queries, you can ask him. About an hepatic encephalopathy. And Maria Majan. Oh, okay. Okay, doctor, you can ask.
Doctor, please explain microbiome gut liver brain axis.
So it's I think it's a hot topic in most of the specialties right now. Not even specialties, in all the fields of science right now. Many YouTubers are also talking about that, using of curd, yogurt, the difference. I think I hope you have heard of that, the kefir. Like all these are bacteria. We are not a single being. We are a multicellular organism, but inside us there are huge plethora of organisms. Now, we might think they are single cellular, not that important, but the single fact is they are very important in our body's antigenic response and immune system. So you might all have noticed allergic tendencies in children, asthma, like I mentioned earlier, COPD, CKD, and all those things. Right now, you've treated patients with an elevated IgE levels and AEC levels. Now they are having chronic allergy. Now we have probiotic powders that can work as good as any antihistamine drugs or anything that can decrease a chronic allergy. These are just bacteria, and how they work is they regulate our immune system. They produce all those different mediators, and through that and their antigenic response, they improve our immune system. Similar to that, in HE, if there is an infection, the bacteria and the body can cause an increased level of ammonia, and similarly, a healthy bacteria can decrease that also. So our body has its own defense system. This defense system will get weak in different kinds of infections, all chronic allergy conditions, including like I've mentioned, CKD, COPD, and all those things. Now, and that alteration or that change from the normal is known as dysbiosis. And when there is this dysbiosis, there will be an increased production of neurotoxin. And this increased production of neurotoxin will precipitate HE. Now, what I mentioned till now, you can extrapolate it to everything. HE, chronic kidney disease, COPD, chronic allergy, urticaria, all those things. And most of the diseases that we might classify as cholinergic urticaria, it can be because of this. So right now, like I've mentioned, because of the advent of AI and huge computing systems, because earlier, if a drug had to be designed, a person had to design it on their own, try it by trial and error, trial and error, trial and error. Right now, the scene has changed. The AI is designing drugs, molecules at a very, very, very rapid pace. I'm not going to the detail, but oncology drugs, the protocols are being changed every month because of the advent of newer drugs. Maybe in a few years, it will go into a rapid change that one day treating cancer will be like treating a small infection, very mild infection, maybe in 1 to like 3 or 4 months. A very severe case of cancer might get cured. I'm just talking into a science fiction thing, but I don't think it's a fiction right now. It's going on right now. The only problem is we have the software. The hardware is it's something called quantum computing. The quantum computers are not ready right now, but once it's ready, the software is there, the brain is there, the body needs to accommodate that brain. That body is being developed. So that's about the gut-liver brain axis. So it's about probiotics. I would advise that something that I advise every mother, every mother that comes into my OP, don't give your children unnecessary antibiotics. Give your children healthy food. If your child is playing in the sand behind in your house, I've heard of parents when we mention let your child play in the sand, then the grandparent takes the sand, filters it, cleans it 100 times, and takes the sand and use it. That's not what we are talking about. We are asking you to let the child play inside the sand. Let the child get exposed to all the bacteria, all the antigens. And if the child is not exposed like that, the child will develop allergies. The child will develop autoimmune diseases. So why is there a huge increase in the number of autoimmune diseases right now? If you just analyze it, autoimmune diseases are more common among children who are not exposed to antigens during their early life. And because of that, their body just reacts to the antigen, and this antibody cross-reacts with our own body's cells. There are a huge number of examples. Like I've taken, like I've mentioned, earlier on, I've taken classes on thyroid disease, and Hashimoto's is something like that. Most of the I've stopped the thyroid drugs for like more than a dozen patients. I've stopped the drug, stopped Tyronome. I do the TSH, I check it regularly. I change their diet, I change what their lifestyle, and I've been able to stop the drugs, like more than a dozen of them. I've been able to at least reduce the dose of a huge number of patients, and I've also tried to I could avoid starting Tyronome by identifying it earlier on, all these autoimmune conditions. And why it's happening, it's because of the altered diet. Like it's a simple question. Right now I think it's 9 or something, right? I think it's 9. Right now it's 9:16. How many in your own homes? How many of you had dinner? Finished your dinner? Or how many kids are there was yet to have dinner? So that will give you the reason, that will give you the cause of why there's a huge number of increase in diabetes, there's a huge number of increase in hypertension, why kids are not able to sleep, why kids are always having lethargy, why they sleep in school, why they're not able to concentrate, why kids are having ADHD. Like, if I remember correctly, when I was a kid, like 5 or 6 years old, or maybe 8 years old, we used to see that Jay Hanuman serial and like on all those late night serials. We used to sit up. We were sleepy before that. We need to wake ourselves up to watch that serial. But right now, kids are having dinner at 10, and they are going to sleep at 12, 1. They're using their mobiles. So all these things will eventually catch up, and then well, then doctors get to survive, I think.
Thank you, Doctor. The one thing you told is exactly correct, because nowadays children are not getting along with the environment and to the nature, because everyone need clean atmosphere, cleanliness, giving more importance to cleanliness, not allowing them to play outside. We are making them like our expectations is changing. Anyway, Dr. Boblim has raised hand. Dr. Boblim, you can ask, please. Unmute yourself.
Thank you. I'm Bob Lim from Malaysia, and I'd like to say thank you to Dr. MRIDUL Murali Krishnan for giving a very detailed technical talk on the hepatic encephalopathy and the pathophysiology of it. Even though it is from the allopathic point of view, but technically and pathophysiology, it is very, very, I would say very useful also, that add to our knowledge. And I'd like to just share with Dr. MRIDUL Murali that and the audience here that in homeopathy we have a certain remedy that can replace what antibiotic, because if you are taking antibiotic, you might destroy the flora inside the our gut system, so which is not very good, as you say, for hepatic condition. We have a remedy called echinacea in homeopathy, and it doesn't have the side effect like antibiotic, so which is also very useful when they're dealing with this case of a liver problem. And another thing is we have also chelidonium, which is very, very linked to a liver function problem and liver problem. It acts some sort of as a tonic also for the liver. So in homeopathy, we don't have to resort to a lot of drugs that have a side effect. I think from the information they are given, we have an idea of how to approach the cases you have mentioned. And thank you very much for your information. Over to
Thank
you,
you.
Dr. Anjini.
Thank you so much, Doctor, because you are regularly viewing our program. You are the IFPH representative of Malaysia. Thank you for being with us. And Dr. Mahmoud Saidan from Turkey, right? Doctor, you can ask, please.
Am I audible, please?
Yes, you
Audible?
are. Yeah.
Thank you very much. Since as per the presentation, it tells us there is GI disturbances or GI inadequacy. Can we think of homeopathy treatment which can be used for GI disturbances? Can we think to treat such a patient with this treatment, since it is GI originated? For example, Nux vomica. Can we use Nux vomica to treat such a patient, since it has a GI origination?
Actually,
I don't think
think
I won't
Dr.
be
Mridul,
the person for that.
Dr. Mridul is a allopathic doctor, so he is not mentioning about the therapeutics. Only he's giving explanation about the disease.
Thank you, sir. Sorry,
Anyway,
ma'am.
thank you so much for asking.
Thank you very much. That was interesting lecture, actually.
Yeah, it was really interesting. And for the therapeutic details, we will have another class from the homeopathic.
Thank you very much.
That's why I skipped over that therapy portion of my presentation for that, because our therapy concentrates mainly on but the main treatment part for us is treat the cause. As far as I'm concerned, always treat the cause. Once the cause is corrected, the body itself is able to heal most of the times. Just for a fact, most of my COVID patients, none of them ever had a severe. Most of them who from the very initial part who were under my treatment, none of them were hospitalized. Now, because I gave them quite balanced supplements, and initially one of the drugs that was thought was Montelukast, a drug that's given for rhinitis. From our part, it's an allopathic drug. The drug which was thought, people thought it was being given for rhinitis, but initially when I read about it, the drug was able to stop the replication of Zika virus. So when we extrapolate it, it was able. I thought it might be good for corona, but later on, maybe 1 year or 1.5 years after, the study came out that it was able to decrease the replication of coronavirus. So just like that, if we think outside the box, many things are possible like that. One of the most important thing is omega fatty acid. Omega fatty acid is something that was being used in Kerala and in India, like in the all over the world. Like we used to call it fish capsules, fish tablets. Omega fatty acids were proven to prevent a severe ARDS in all lung infections. Like it's something that I take 2 tablets a day. I take it every day. Right now, I think I've seen more than 40 or 60 patients, maybe with influenza in the past 1 month. With like maybe most of them were having H1N1, H5N1, and all those things. I sometimes tend not to use a mask. Like I try to test it if I'll get the disease. But for the past 3.5 years, I haven't got a cold. But before that, I used to get it every time. Whenever I see a child with a fever, like the first thing I think, next week I'll be getting a fever. I used to get a fever every time I see a pediatric patient, a child with a fever. I always used to get a fever. But now for the past 3.5 years, 4 years, I haven't had a fever. But because I take my supplements regularly, because if we keep the best doctor is always the body. When the body is kept healthy, the doctor knows. But we need to give the doc, like it's like in the old age doctors, they used to make their own drugs, because for homeopathy doctors, you always mix it and use it. But for us, we just prescribe it, and the pharmaceutical companies give it. But if you don't have the raw materials to make the drug, the doctor can't work efficiently, right? So for the body to work efficiently, we need to give it the raw materials. Like I said, even if he's a great mason, he needs the brick and the cement. You give the brick, you give the cement, you give the plastering, all those tools, then he'll make a great house. God has given us all the necessary resources. We just need to utilize it.
Thank you, doctor. A doctor is keeping ethics because he already mentioned that he reduced some medicine for the thyroid diseases. He changed the lifestyles and reduced the medicine use. That is a great thing. Normally, I don't know, in this time also every doctors will do that, or I don't think so, because everyone is giving more importance to taking medicine.
No, like so something that I stress to all my patients is diabetes, including diabetes. Diabetes is a very easily reversible disease. Right now, I might be having maybe around 600 plus diabetic patients. Only a handful of them will be taking insulin right now. And
how only changing the lifestyles?
No, not only changing the lifestyle. I'll prescribe them drugs, but I'll taper it down, and I've been able to stop drugs for maybe more than 20 patients. They have achieved complete diabetic reversal. They are not on any drugs right now. No medicines, maybe just supplements, vitamin tablets, just that. And a few of them were on insulin. The ones whose drugs were completely stopped, few of them were on insulin, because there is a huge misconception of what can be taken, what the patient can eat. People think that everything that is sweet is wrong for diabetes, and everything that's not sweet, that's good for diabetes. That's not wrong. Taste, sweetness, it's a taste sensation. It's on your tongue. If you eat a miracle berry, just chew it and drink with some vinegar, then it will be really sweet. If you use the miraculin tablet or miracle berry, it's a simple fruit, a small seed-like thing. You just chew it, spit it out, and drink a bit of vinegar or just plain lemon juice without adding any sugar, nothing. If you just swallow it, it will be really sweet. It's because it works on the receptors. So if you eat something that's not sweet, it doesn't mean it won't be harmful for your body. And if you eat something that's sweet, it doesn't mean it'll necessarily rise your blood sugar that much. So if you adjust the lifestyle and adjust the medicines and all those things properly, then diabetes, hypertension, all those diseases are reversible.
Yeah, this message we have to spread, because whenever anyone is getting diabetes, the first message is it is an irreversible disease. The people get repeatedly hearing the same message. They have that faith. I mean, okay, I got diabetes, that is irreversible. So this message we have to spread. It is a reversible disease. Likewise, everyone have to say, even the
there is an entity like that. There is an entity right now called diabetic reversal.
Oh, okay. So people are okay. I started. I became a diabetic patient. Now it is irreversible. Lifelong, I have to carry with this. Likewise, they are changing. Anyway, thank you, doctor. I think now it is the time for the Malayalam session. As your name, like MRIDUL MURALI KRISHN, like it was most of the international participants don't know the meaning of the name. MRIDUL means soft, Murali means a flute, like a soft flute music. We heard his class. It was so nice, and it gave us great awareness. And your views and ideas are, I really loved your views. Thank you so much. Come again And Dr. Ram Parvesh, sir, please say vote of thanks to Dr. MRIDUL Murali Krishna. We are already, it is the time for the Malayalam session.
Thank you. Thank you, Dr. Anjali, and congratulations,
Thanks.
Dr. MRIDUL Murali Krishna. They are good name, beautiful
Yeah.
name. MRIDUL Murali Krishna.
Yeah, my father is listening in,
That's
so
God.
I think he heard that.
It's
Krishna, thank you. Krishna is a God. Mahabharat. So, MRIDUL. So very, very thanks. Very good presentation, excellent session. Therapeutic hepatic disorder according to allopathic science and according to homeopathic science, main cause of disease, emotional, dynamic. Dynamic. So
thank you, Doctor.
very thanks on behalf of IFPH. Very thanks, Dr. MRIDUL Kumar, MRIDUL Krishna. Thank you.
So much. Now we are moving to Malayalam session. Thank you all the participants, faculties, everyone. Bye-bye, good night. Before that, tomorrow is our Independence Day. Happy Independence Day to all. And please do remember, many freedom fighters fought against our, fought to get our independence. So while we are celebrating or while we are enjoying that independence, please remember them, please salute them for 1 minute. And we are moving to Malayalam session. Dr. Mariamma John, please.